Hi, I'm Dr. Jess,
I'm Dr. Matt.
and this is No Pain is Gain. And we are going to tell you on today's episode how you do not have to live with pain.
The old adage is wrong. Pain is not a reward for hard work, nor is it an unavoidable consequence of aging. Let Dr. Jess and Dr. Matt be your guides on the path to a fuller life with less pain on No Pain is Gain.
Today's episode is going to include different ways that our bodies are supposed to move to decrease load on your joints. No longer being told that you have arthritis and you have to live with it. So let's get started. Many people might be living with knee pain today. You might be having knee pain. You might have been told that you have to live with knee pain, that it's arthritis, that you're getting older. But what if I told you you don't have to? And that's what this episode is today, to teach you that the mechanics of the body, the way that we move, the way that we're designed to move is to help eliminate pain. So we just got to teach you the right way to move. And that's what we're going to do today. We're going to take a deep dive into someone who might have knee pain in a very common area when going from sit to stand and how we can improve that. Okay, so going from sit to stand, why is it causing your pain? Well, first we have to analyze and look at how you're going from sit to stand because quite frankly, there's a variety of ways to go from sit to stand, and I need to observe what part of your knee are you loading and how are you going from sit to stand. So that's the first thing. I'm going to have Matt show a variety of ways that people can go from sit to stand. So Matt, let's demonstrate one way that I see several people go from sit to stand. And here you're going to see the knees come in and they touch, okay? And let's take a pause here for a second. That there is going to load this part of the knee repetitively, almost to the point where many individuals will say they have arthritis there. It hurts in the medial part of their knee. Another thing that I see with people going from sit to stand, let's turn your feet out. Yep, and then go ahead and stand. Right? So now this loading is more on the lateral portion of their leg. So you might actually have some more outside knee pain. What if that has nothing to do with how you go from sit to stand? What if you actually favor one side? Lean, right? Perfect. So now you're loading something completely different. So the big takeaway here is that first you have to understand how are you going from sit to stand so that we can fix it because it's how you are loading. Now I want to demonstrate the best movement pattern to go from sit to stand. That is going to be feet forward, knees in line with hips. So if you were to draw a straight line, it's here, it's not here, and it's not here. When I say feet forward, that's second toe forward. That is normal alignment. You want your second toe forward. You don't want to be too far in, and you don't want to be too far out, okay? So second toe forward, knees in line with your hips. You're going to use the armrest for right now, and you want to make sure you actually lean, nose over toes, and then push to stand. That is optimal alignment, and if you can master that, then you're going to be able to transfer from sit to stand with no pain. I'm positive. The challenge becomes, and this is our next clip, the challenge becomes, how do we get that to happen? You might have stiffness, you might have weakness. Where is it and why are you choosing this sit to stand position? There's a reason you're choosing to turn your feet out. There's a reason you're choosing to let your knees collapse. So let's take a look at what we do to figure out why you're doing it. Okay, so got to figure out why are you choosing to go from sit to stand in the nature that you've chosen to go. So with that, we have to look above and below the knee, just not at the knee. How many people have ever been looked above and below to see how it impacts the knee? Most times people just go straight and look at the knee. But again, this is mechanics, this is movement. We move as a whole body. So as we do different functions, we need all parts moving together for the best quality of movement. So we're gonna first start with looking at Matt's movement from bending forward and extending. Go ahead and bend forward for me. Good, and come back up. And then go ahead and extend back. Perfect. Now, how does that impact the knee? It does from so many levels because, again, if you are tight in the front of your hips, it's going to change the way that you move and load the knees. Matt is cleared, so that we're going to rule out. The next, after we look at the back, you look at the hips. Go ahead and have a seat. The hips play a huge role in how you load the knees. So that if you are tight in your hip joints, you are going to load your knee in a different way. For example, one demonstration was where someone who gets up from sit to stand, their knees come in together. I always call it the kissing position. When that happens, the hip joint might be stiff where they don't have this motion out here. So they have no choice but to move from the hip joint this way. So if someone's stiff here, you might see that their knees cave in. So another thing you have to look at is the hip joint. Same thing this way. You would look this motion and this motion to see if there is any restrictions impacting how you load the hip joint. Okay. Now we got to look at the knee. So you want to look at the motion at the knee joint. You want to bend your knee. Perfect. And then straighten the knee. Now, many of you can see that how if someone is limited with bending, how sitting from a low chair is going to be almost impossible, which might be one reason why you shift your weight, right? Just a possibility. If someone doesn't have full knee extension and they're unable to straighten their leg, then they might not be using their quads to help facilitate them standing, and that might be another reason why they are loading to one side. They're favoring the other leg. So we would look at the knee. We would look at the motion at the knee joint to see, is that potential limitation? Then the last thing we would look at is to see, is it the ankle joint? Is the ankle restricting the way that someone is moving properly? So if you were to pull your ankle back, you need about 20 degrees of ankle back. If you stop at 0, there is a good chance that you're turning your foot out to clear when you go to sit to stand. I'm going to demonstrate that. When you go from sit to stand, this part of your ankle needs to go over the toe. If you don't have that motion in your ankle joint, which is this motion, you will have no choice but to load at the knee. So sometimes it's just stretching the ankle joint. Sometimes it's giving you some freedom in your ankle so you can get that second toe forward for great alignment and then translate to lower yourself down on the chair. So people who present with that type of movement dysfunction typically have loss of hip rotation and loss of ankle dorsiflexion, which is bringing your ankle back. When your feet turn out and your knees come in, that typically is what presents. Now remember, everyone is individualized, and that little portion where we examine why you are moving from sit to stand in the way that you do is huge in determining what we do to help. But on a global scale, the majority of times you'll have tight hips externally and tight ankles bringing your foot back, okay? We also see weakness, and the weakness that we see is actually in your glute med muscle. Go ahead and lay back, yep. Go ahead and bend your bottom leg and straighten this leg. Perfect, hold that there and let me push you. So that muscle there should help stabilize the knee joint, and typically we see that also being weak. So what do we do to fix it, right? Now that we know where your limitations are, we have to improve motion and improve strength. So that's what we're going to show you next. Okay, so to improve hip joint mobility, there's so much flawed education out there where you can take muscles and stretch them and do different things, but you have to imagine, we have to be mindful, if this knee is already irritated, go to do this crossbody thing. That's not gonna be a good stretch for you. And again, when you stretch a muscle, you stretch the length of it, but you're not getting to the hip capsule, the joint that actually needs moved. So this hip joint mobilization is key for the whole functional pattern to be restored. So how I'm going to restore external rotation is I'm going to put this around his hip. Again, we have to be sure that they don't have a hip replacement or anything of that nature. There's different techniques that you'd want to do. Everything is individualized, but this is just a basic kind of presentation from how we restore hip motion. Okay, and then, yep. All right, so now I make sure he stays really relaxed. I almost want to make sure that we're in that 90-degree, that perfect angle. And then what I'll do is I'll gently take the belt and distract it as I start to work on his hip external rotation. And as I do that, I'm going to free up his motion so that he doesn't have to be stuck here and he can actually get some range in the back part of his capsule. So we'll do some mobilization here to restore hip joint. To restore ankle movement, same thing. Stretching your ankles is great, but sometimes the calves are known more of like a spastic muscle that like stretching them may not make the change that you're looking for. You need the joint mobilization to occur simultaneously or in conjunction with your stretching. So to do this, when your ankle goes back or when it needs to go back, this part of your joint needs to go that way. So to do that, I can do a nice little glide and follow it up with a nice calf stretch. And then there's ways that I can also teach how to self-mobilize the ankle joint, which we'll show you right here after, because you got to improve mobility in the ankle and in the hip joint. Now for demonstration purposes, I jumped onto this ankle, but if it was this knee that was hurting, you'd want to treat this ankle. So again, individualize the plan of care and find out which impairments are causing you to choose the way that you go from sit to stand. All right, so the last component is the strengthening component, and something that we see that correlates with that movement pattern of sit to stand, feet turn out, knees come in, is that you have a weaker glute med. So to strengthen glute med, you have to be very specific to that muscle. So corrective exercise is key. It has to be very specific. So what I have Dr. Matt, first and foremost, is I have his back up against the wall to make sure that his back is not going to play a part in this exercise. I'm going to place this loop around his hip joint, and I'm going to put his feet up against the wall. I know many people have heard of the piriformis muscle. That muscle and glute med both rotate the hip away. So that motion that I restored for Matt, both the piriformis and the glute med do that exercise. However, or do that motion. However, we don't want piriformis, we want glute med. So to take out glute med, piriformis would be with the hip bent at this angle. Glute med is at a 45-degree angle. So that is something else we have to look at. The other thing is as he rotates up, and he's going to hold that, that activates glute med. Now this muscle is a stability muscle. I do not care about force production. I don't care how much force he can produce. I care, can he sustain that contraction for 10, 15, 30 seconds 3 times, 5 times. That endurance approach is going to facilitate that wakening of that muscle that's going to allow for you to move from sit to stand repetitively throughout the day and stabilize the joint. So this is one of the exercises that we would use to activate glute med. So after you activate glute med, after you put some motion in the joints, our brain functions with movement. So those exercises don't always correlate to what we're trying to do. The next phase that is so important that people skip is the acquisition and assimilation. So after activating the muscle, we have to put it into movement. It needs to know that it has to work with all the other muscles simultaneously. Remember, it's not force producing. It does not care to produce 50 pounds of force during one motion. It's a light contraction that works together with multiple joints, multiple muscles. So I just want to review the wrong movement that we have been trying to analyze and fix. So turn those feet out too, Maddie. Yeah, all right, go ahead. So that is the motion that we were working on. So if we did, you can stop, if we did the motion in there, the strengthening, and then I said, okay, Maddie, go home and do your thing. Our brains, we think and move subconsciously throughout our days. We'll go back to these old movement patterns. We have to work on that. And that is what the acquisition phase is of healing. So now we have this band to start to facilitate movement. So we want second toe forward, and we want knees in line with your hips. We don't want too much. We just want right in there. So that's where this band is going to work. I'm going to encourage Matt to use the handles right now, or the hand, and push to stand. As he does that, he has to control that band on the way up and on the way down without letting his knees collapse. Now, Matt is able to do this because we restored motion. We worked on some activation. Sometimes you can't just go into this and expect it to be there if you have tightness, if you have weakness. It's easier said than done to say, put your foot forward, keep your knees in line. But if you don't have the stability and you don't have the mobility, there's a reason why you're choosing this pattern to begin with. So we got to get you back to the normal patterning. Do one more time for me. And as you can see, by doing this, we no longer stress this part of the joint. We are taking the force and basically distributing it throughout his body when he goes from sit to stand. So as he does this, he will be able to move from sit to stand pain-free.
Hey, thanks, Dr. Jess.
No
So,
problem.
as you guys saw there in today's episode, it's a very, very comprehensive process that we always go through with our patients. And, we focused on one particular movement dysfunction today, which Dr. Jess went into great detail, but we kind of take that same philosophy to all the different movement dysfunctions. Once again, knee pain is not generalized. Everybody doesn't have the same problems when they come in, and it really is that individualized process of going through the evaluation and matching the interventions to that specific dysfunction that really sets us apart with our patients and really gets those results instead of just blaming arthritis or blaming aging. So, like I said, hopefully we gave a little bit more insight as to some of the things that we can provide to our patients that come in, but that definitely is just the tip of the iceberg, what we showed today.
Yeah, thanks, Dr. Matt. And I think the big takeaway is really understanding that you do not have to live in pain, understanding that there is a proper way of movement, and understanding why you're moving the way you are right now. And fixing that is really the way that you can move and live your life pain-free. So there you have it. No pain is gain.